And we will have time at the end for a Q&A, so please feel free to drop any questions in the chat, and we will be monitoring and addressing them at the end. Now I'm excited to introduce our wonderful panel of speakers. We have Melissa Angel. She's a yoga and massage therapist at Synergy Wellness. We have Dr. Michaela Cussin. She's a chiropractor at Worcester Family Chiropractic. Julia Walker, she's the owner and dietitian at Bloom Nutrition. And Talia Keshner, a pelvic floor therapist at Raquel Paralis PT. We're so grateful to have such knowledgeable and dedicated group of professionals joining us today. So thank you, everyone. And to get us started, we wanted to introduce why we are here today with, next slide, please, Karina, with a little bit about the maternal health initiative happening here in the Metro West. So our initiative is called Healthy Parent, Happy Baby.
Yes, thank you. I'm Karina Scott. I'm the Shared Services Coordinator, and I wanted to let you guys know a little bit more about the program components. So we have five main components to our Healthy Parent, Happy Baby initiative. We have free birthing classes, and so far to date, we had about six. But Talita will go into more depth on that. We have distributed baby care packages. We have created postpartum support groups. And this symposium is part of our connecting to resources and our other component of increasing maternal health awareness. So these two components are really to help individuals who are expecting, have given birth, or have a support or are supporting someone through this new journey, connecting them to resources, making them aware of all the rich resources in their neighborhood. And if they're not from our Metro West area, which is okay, we have a couple people from not from this area, they at least know that there are resources that they can look if there's something in their own backyard for these things. But we wanted to help folks know that there is resources out there that they can seek. Most of them covered by insurance, but that's part of our initiative that we wanted to do. And let's get stuck. Sorry. Talita will talk to you a little bit about our fun part of our initiative, the community baby showers.
Yes. So to date, we've had 2 baby showers, hopefully our third happening next month. Our first community baby shower happened in June, so almost a year ago, last year in Hudson. We had 55 people registered, which is not representative of the number of people who attended. Folks were bringing, partners, kids, parents. So we definitely had well over double that amount of people attend, which was amazing. 14 community partners. So this was kind of set up like a resource fair. And these community partners were kind of along the edges of the room, and they were each there with a little table to kind of talk about the resources that they have and what their organization does. Each participant that attended received a maternal health tote bag, as you can see a picture there on the top right. That included a baby blanket, a baby hygiene kit, a dental hygiene kit, a bottle cooler, and a water bottle. We also included folders with language-specific maternal health resources and materials. We had information about things that Mass Health covers, for example, for new and expecting moms. And then we also had a lot of raffle prizes. So everyone also got a chance to participate and win a gift. And then baby shower number 2, November of last year. This was at the public library in Framingham. We started off really strong. We had 89 people registered. Again, well over 89 people attending. 14 community partners, and these community partners were great. It was people spread all across Metro West. We had, early intervention. We had people from clinics, and we just had a variety of community partners, which was great. All participants received custom tote bags again. And this event, since it happened at the public library, it was really great because it attracted folks who weren't expecting to stumble upon a community baby shower. So we actually had a lot of people come and sign up at the door and leave super happy and excited that they we're at the right place at the right time. So Um, our favorite part of the community baby shower, next slide, please, Karina, is our baby boutique. So everything at our baby boutique is donated. We are very fortunate to have communities who are super interested in wanting to help make this event so successful. So our baby boutique, instead of just handing out items to folks who come, we really want parents to feel like they can actually have that shopping experience and choose what they want and what they need for their baby. So each attendee is given a shopping bag and they can kind of choose and go through things that we carefully organize and put together for them. We have gently and gently used, sorry, in new clothing. We have formula. We gave each participant diapers and wipes. And overall, it was just about creating that space of feeling supportive and respectful and just centered around choice for the moms. So that was our favorite part of the community baby showers. Next slide, thank you. Another component of our initiative is the virtual postpartum support groups. So these support groups happen every Tuesday. They are online. They are doula-led, and it's just a space where new parents can receive guidance, share experiences, and build community during the postpartum period. These support groups are offered in English, Spanish, and Portuguese, and we are hoping to restart sessions this summer. And the good thing about these support groups is that they are drop-in, so there's no commitment, which we have received really good feedback about. And then the third component is the childbirthing education classes. So these classes are also doula-led. They provide emotional support, teach birthing techniques, help with empowerment, and also help to build confidence for both labor and delivery. We offer these classes again in English, Spanish, and Portuguese. And we try to host these classes all across our SSA. So we've had them pretty spread out. English to date, we've had two sessions, one in Hudson and the second one at the Natick Community Center. We've had two Portuguese sessions, sorry, one in Milford and one at the Framingham Public Library. And Spanish, we had the first session in Framingham and the second session we had to reschedule and are hoping to get that up and running soon. We've also had great feedback. Folks are able to bring a support person. We provide lunch. And again, all services are free and open to people beyond the Metro West area. So hopefully when we get other sessions coming up, we will be able to share that information out with everyone.
Thank you, Talita. If you want to find out more about our initiative, specifically numbers or just information, please visit our website. You can see our specific maternal health report. Talks to about what we have done in our first year. We have entered our second year in this pilot program. It was very successful. We tweaked it a little bit. We've constantly do feedback, which is very important to us, so that we are moving the initiative according to the needs of our community. But yeah, please look at it in our website as well. We're planning our third community baby shower. The date is June 30th. It will be in Ashland, location to be announced on a later date. But if you're interested in attending or getting more information, please scan to register at the QR code on your screen. But if you want to find out more about our postpartum support groups that will be starting off soon, and other programming that we have, there is a QR code as well in the screen where you can scan and sign up to be connected to us, to be part of our email list. We will be emailing our flyer for a community baby shower, postpartum support group, and also everyone who attended this webinar will also receive a feedback survey. Again, as said, feedback is really important for us, so we want to know what worked, what didn't work, what did we miss. Hopefully this is not our last symposium. It's going to be our first. So we want to make sure that we address all the needs of the community again, and make sure we haven't missed anything. But without, I know what everyone is here for is to hear from our panelists. To get kick started, we have Synergy Wellness located here in Hudson. So I will let Melissa take over. Thank you.
Thank you, Karina. That all sounds so great. I'm looking forward to hearing more about when the next event is. I attended an event last summer, or the beginning of last summer, right here in Hudson. It was amazing. There's so many great vendors and so much information. So I urge everyone to go ahead and um, register to find out about the next baby shower coming up uh, at the end of June. So I'm here mostly to talk to you about yoga or prenatal yoga, postpartum yoga classes. Um, Again, I'm Melissa Angel. I work here in Hudson at Synergy Wellness Center. I lead up the massage department and also teach yoga classes. I am a licensed massage therapist specializing in prenatal and postpartum massage, as well as working as a birth doula, supporting um, births in local hospitals in the area. So thank you for having me today. So a little bit more about yoga. Yoga is an ancient mind-body practice that originated in India thousands of years ago. Um, in pregnancy, yoga can be so helpful because it helps you relax, including breathing, with movement, meditation, and relaxation practices. Also, helping you move your body in ways that feels really good, helps baby get into optimal positions during pregnancy to keep you comfortable, and also supporting physical and emotional wellness. We can modify the yoga classes for pregnancy in a gentle yoga class, but I also urge you to seek out a prenatal or pregnancy class. During pregnancy, it's so wonderful to be able to connect with other people that are going through the same thing, in the same experience as you during pregnancy, and creating a community around that. So we have prenatal yoga for strength and relaxation. We have postpartum yoga for support and recovery. And then we also have a baby and me yoga classes for connection with your baby and your community. In prenatal yoga, we'll build strength, flexibility, balance, and help you prepare for labor. It can help support and reduce any discomforts that you have during pregnancy, such as lower back pain, headaches, and will reduce stress and anxiety. Moving will always improve sleep and overall mood and create connection with other expecting parents in the community, as I've said. And postnatal yoga, we support some gentle recovery after pregnancy and birth, rebuilding the core and helping you understand how to engage your pelvic floor to rebuild the core. It supports better sleep and mood and also encourages mindfulness and body awareness during any postpartum changes that you have, providing social connection and support. And finally, we have Baby and Me yoga, which is such a fun thing to do with your baby, bonding, bonding with other parents in a safe and fun environment, supporting your baby's movement, sensory development, and relaxation, helping give you some ideas for encouraging calm routines and regulating that connection between you and your baby. Coming in for a Baby and Me class will support building community with other new parents, and also it can be adapted for all different ages and stages in parenting, and of course your baby's age as well. Um, So, some important notes to add. I thought about checking in with your OB or midwife before starting. There aren't a lot of contraindications for starting your prenatal or your postpartum yoga, but definitely just feeling overall well to be out of the house for a few hours and just checking in with your doctor that that's a good thing to go forward with. Definitely avoid hot yoga and overstretching. Please let your yoga instructor know if there's anything going on in your body to address or to avoid during a yoga class. And then listening to your body, slowing down or stopping completely if there's any thing you're experiencing that does not feel well in your body, such as dizziness or pain. Um, if you're still in pregnancy, contractions would also be something to look at, as well as shortness of breath. And for postpartum participants, just follow your provider's return to exercise guidance when coming back into the yoga studio. So yoga is not just an exercise, it's connection, confidence, and support during a major life transition. You can find a prenatal yoga class here at Synergy Wellness Center every Saturday afternoon with Valerie Casey at noon. I will be finishing up my yoga teacher training for prenatal yoga actually this weekend. So I'm really excited to get started with some classes on the schedule as well. Before the end of summer. So now it's time for questions. I won't be here at the end, unfortunately, to hear everybody else's amazing information that they're sharing. But if there's any questions at the moment, I can stay for a few more minutes to answer them.
Yes, if anyone has any questions, please feel free to put it in the chat now for Melissa. We'll take a minute or two. Thank you so much, Melissa, for sharing. So important for the wellness of both baby and mom. We love
Thank
to hear
you.
it.
Thank you. Yeah, I'm really happy to be here. I also, as I said, specialize in prenatal and postpartum massage here at Synergy. So it's also a very helpful treatment to seek out for comfort during pregnancy. We use the body cushion system, which is very comfortable and luxurious for women to have the opportunity to lay in a prone or a face down position during pregnancy, which they usually don't get to do comfortably and safely.
We do have a question in the chat. So which trimester is best to practice yoga during pregnancy?
It's really best to probably start out as early as you can in your pregnancy. As you go on later in your pregnancy, you might find that you have more discomfort. So, doing things that you're used to doing will help keep you feeling, more comfortable as you move through the pregnancy. So, I would say, starting out as early as you can is best.
That's great. Thank you for the question.
Yeah.
What age, this is me asking a question, at what age can you bring a baby to yoga for baby and mom?
You really any age. So I think it goes well any age as far as newborn as you feel comfortable like coming out of the house for a long period of time. It's perfectly acceptable to feed your baby in a baby and me yoga class. It's perfectly acceptable for your baby to sleep through a baby and me yoga class. So I believe it goes newborn up to about 6 months, and then they start with or up to I'm sorry, up to about 1 year rather, and then it starts with the toddler and me classes as more movement is happening in your with your baby. So they change up the class a little bit, but really anything goes. Your instructor is going to understand that things might be need to be modified for different ages in the class, or different energy levels, and different curiosity levels. So it's just come, and if they suggest, well, you might like the toddler and me, your baby's really an on the go baby at a young age, then you can always just switch over to the toddler and me class the following time you come.
I love that. Something for every age.
Yeah, exactly.
Well, thank you so much, Melissa. If we don't have any other questions, thank you for sharing, and we will keep you posted on if folks happen to have any further questions for you in the chat. Thank you so much.
All right. Thank you, Thalita. Have a good day.
You too.
Bye.
Next, we have Dr. Michaela Cussin from Worcester Family Chiropractic.
Okay, there we go. Hi guys, I'm Dr. Michaela, aka Dr. Mick to most of our children around the office. In our opening slide here, it's just very representative of the demographic that we work with. We specialize in prenatal and postnatal care, pediatrics, but we do joke around and always say that we're Worcester Family Chiropractic for a reason. So we will continue to care for grandparents, aunts and uncles, the dads as well too. So we're very inclusive to all of those family needs because as we know, caring for a child takes more than one person. It's a tribe and a village. A little bit about myself. I graduated from what when I went to school was called the Northeast College of Chiropractic. It is now Northeast College of Health Sciences as they've added more majors into their curriculum. I graduated 5 years ago, which is hard to believe. I currently am working on my board certification in prenatal and pediatric care through the ICPA, which is the International Chiropractic Pediatric Association. The doctor I work under, who owns the practice, Dr. Brittany Falcone, she's been practicing for over 10 years now, currently holds her board certification in both of these specialties, and she's my personal mentor as well. A humble brag about the office for the next slide. We have been voted Central Mass Best Chiropractor many years in a row, and we're very honored by that. We take pride in being a small office, a private practice. Our front desk staff knows almost everybody by name, including their children as well too, maybe their dogs, cats, pets, and fish. We enjoy being able to have that small, close-knit community. We also really want to make care accessible to mom as well. So one of the challenges is that once baby is born, they tend to take precedent. It's hard to find childcare to make time for yourself. And so the staff here are willing to help hold your child, maybe rock them in the car seat while you're getting seen for your 10-minute appointment so that you can care for them as best as you can at home. So, covering a little bit more about our specialties, pregnancy and postpartum care can look very similar and different at the same time. One of the things we like to say is that almost all chiropractors can treat pregnant women. However, maybe we're not doing enough for them. And so Dr. Brittany and I are Webster certified. It's a really specific chiropractic analysis that we'll touch base on in the next slide. But during pregnancy, you may see common aches and pains show up, such as pubic symphysis disorder, round ligament pain, just generalized low back pain. It's a lot to carry around, and your center of gravity is going to change, sciatica. And one of the most popular reasons why people will come to see us during their pregnancy is actually for breech positioning. So if baby is not in a head down position, we can chiropractically help baby get down into that position. Postpartum wise, again, the shift in focus tends to leave mom and go to baby. So we get really excited to be able to care for mom during her postpartum journey, that fourth trimester. It's not easy to nurse, pump, or feed a baby. It tends to lead to very poor posture. And if anyone has experienced that themselves, they would know how good it feels just to be able to open up and get into those proper positions. If you had to have a C-section, we do have methods to help break up that scar tissue that also could be causing some aches, pains. And we have created a really cool protocol that's unique to our office specifically, revolving around clogged ducts, which we'll touch base on as well too through the following slides. But let's talk more about the Webster technique. So the Webster technique is really special to chiropractors who are focusing in on the prenatal care. It's a really specific pelvic analysis from both the back and the front side of the pelvis. That's what makes us unique chiropractically, is that these structures support the uterus. So by having a perfectly balanced pelvis, the uterus and baby have more space to sit in a more optimal position, therefore making mom more comfortable, labor and delivery times shorter as well too, and then helping that breech baby get down into a head down position. The second thing that I think is really cool to talk about is the clogged duct protocol. So this is more in regards to postpartum care. Sometimes you'll see clogged ducts occur, whether it's weaning from nursing, pumping, or baby potentially has an inefficient latch on there. These clogged ducts can be broken up through ultrasound. Therapeutic ultrasound uses heat and vibration to break up the milk that's stuck in that duct. And we've created a protocol that alternates between heat and this ultrasonic sound wave to help break it up. Depending on the severity of it, most people only need one session of this, but potentially two. And then this is a great way to prevent mastitis from forming, because what will happen with that clogged milk duct is that an infection can occur, and we don't want that happening. So this is, again, really unique and something that we have kind of like pioneered over the years to offer with our lactation consultants in the area as well too. So the ultrasound, if you want to go to the next slide, this is kind of a little bit about the cost of care, what to expect. Some common symptoms in regards to the clogged ducts are a decreased milk production, maybe redness, tender in the area of the clogged duct itself, not responding to home cares, or maybe you've already had mastitis, but the clog is still there. So those would be cues to come in and see us for this really specific type of care and therapy. So the biggest question that we get is the insurance question. We are a cash-based office, and we really take pride in that, because oftentimes in chiropractic world, the things that we do and specialize in for our infants and for our moms are not covered under insurance. And so we found that being cash based, we can provide you with the best care and support and be upfront about the cost of everything. So on the page, you can see the cost of the initial appointment. It's a 1 hour exam. You get a set of diagnostic scans that look at muscle tension along the spine, inflammation, and how well your body is adapting to the stressors that you're putting on it. Then follow-up visits are about 10 to 12 minutes long with either myself or Dr. Brittany. We do offer packages as well that essentially are like buy 11, get the 12th one free. We do offer, or sorry, we do accept HSA and FSA cards, which patients have found very useful and helpful, because they also can be used for any supplements or products that we have in the office. So you can use it for pillows, you can use it for any sort of creams, you can use it for vitamins, you can use it for special massages that we offer here as well too, prenatal. So the HSA and FSA are a great option to be utilized in the office as well too. And so yeah, cash based so that we can provide the best care for every family and their needs. You can call our office at any point in time. We have patient care coordinators who are willing to discuss any questions you may or may not have regarding chiropractic care and what we have to offer, or how to book those appointments. Thank you, guys.
Thank you so much, Dr. Michaela. That was so insightful. I definitely learned a lot. We will be
Thank
taking
you.
questions for you at the end. And now we will head over to Bloom Nutrition with Julia.
Hey everyone. Thank you for having me today. I'm excited to talk to you about Bloom Nutrition, which is the nutrition business that I am the owner of, and our main purpose at Bloom Nutrition is to support moms and babies through nourishing care. So I specialize in supporting women through pregnancy, postpartum, and early motherhood, with compassionate and realistic nutrition guidance. Today I'll be sharing a little bit about my role, the services I provide. Um, Always happy to go into more detail, and then how nutrition support can benefit both moms and babies. Just a little bit about me. I created Bloom Nutrition because I'm passionate about helping women feel supported during one of the biggest transitions in their life, which is becoming a mother. I started it when I had just had my first child, and I had my most recent job before that had been working in a maternal fetal medicine office. So I got a lot of experience with pregnancy and nutrition, and I found that was my passion. Um, but there's always a lot of talk around like weight and numbers and all that during pregnancy, which, sometimes is inevitable. But I wanted to focus on providing nutrition care to women who are in this vulnerable stage of, either preconception, pregnant, or postpartum, to help them feel less overwhelmed and um, simplify nutrition and food, body image, and wellness during that time. Just because a lot of women feel conflicted on what the advice and expectations are during that time. I hope to help women, or what I do with my patients is to primarily help them step away from guilt and perfectionism and instead build a healthier, more peaceful relationship with food and their bodies, which again seems like a big feat during pregnancy and postpartum when our bodies are changing so much, and there's so much information out there telling us what we think we should be doing. So um, I, I, these are some of the services I provide: preconception nutrition counseling, so helping women kind of see where they're at before they want to get pregnant, or they could be trying to get pregnant at the time. Just see where there's any potential nutrition deficiencies, um, and also just kind of start exploring how their relationship with food and their bodies is at that time is like the best time to start talking about that before things really start to change. And then, of course, I work with many pregnant clients who, have a variety of nutritional needs, whether they just want to learn how to, like, what they can and can't eat during pregnancy, um, how, some fun meal ideas to make pregnancy better, how to navigate nausea during the first trimester or the whole pregnancy, and how to eat to support mom and baby during that time. So that's a little bit about what nutrition counseling during pregnancy looks like. And then postpartum is, of course, um, focusing on how women can support their bodies, whether they're breastfeeding or not, and helping them to recover from their birth, regardless of what that looked like, too, through food and nutrition. And then also, again, addressing the body image and food relationship issues that come up. Um, so, how I support families, I individualize my plans. No one size fits all plans, and as a mom, I know that nutrition can be like the last thing on your mind. So I like to keep things flexible and realistic, for all us moms out there. And one thing that can be hard when you're first starting to work with a dietitian is you want like a strict, you know, um layout of what you can and can't eat, or meal plans, which we do work on. But my main goal is to help foster long-term habits and really dig deep into, why we're doing what we're doing, why we're eating what the way we're eating, how we think about food, and not having nutrition counseling be a quick fix. And I feel like that pregnancy and postpartum lend itself well to that because it is a journey. It's not just a finite time in our lives or some certain condition that needs to be taken care of. It's a journey. So long term is the goal, and always judgment free and supportive. A lot of, or all of my care is centered on intuitive eating, which focuses on, reconnecting with internal cues like hunger, fullness, satisfaction, and regaining trust around food rather than rigid rules or dieting. Um, and kind of getting rid of that all or nothing thinking around food, that we can create sustainable habits that support both physical and emotional well-being during pregnancy and postpartum. So I'm always supportive in that way. And I offer virtual or in-person sessions. And the benefits for mom with working with Bloom Nutrition and me are, of course, to help us feel more energized and nourished, because nutrition support can have a huge impact on maternal health and well-being. So we want to improve energy levels, support pregnancy and postpartum recovery, reduce stress and noise around food, and help improve body image and confidence, so that my clients can feel confident in feeding themselves and their babies going forward. And it's just, again, I want to emphasize the importance of intuitive eating during this kind of vulnerable time, and help so that I can help women break free from chronic dieting and develop a more peaceful relationship with food during this time when self-compassion is so important and often hard to come by at the same time. So a more peaceful relationship with food and your body translates well to benefits for baby, which next slide. Of course, focusing on nutrition during pregnancy and postpartum, well, especially during pregnancy, supports healthy growth and development for the baby. But again, the mental benefits of, focusing on healing our relationships with food and our bodies can help, just promote healthy growth and development in general too. Maternal nutrition during pregnancy and postpartum plays an important role in all of that. And then it's also like the ultimate benefit for baby is that when children grow up around balanced, flexible attitudes toward food that come from their caregivers, moms, dads, they're more likely to develop healthy and positive relationships with eating as they grow. So trying to, get this from birth, just having a more relaxed and positive approach to eating is really important. And, as kids start, once they transition to solids, it can be, tricky to take our own food biases out of it. And just to remember that children are the ultimate intuitive eaters because they haven't been brought up yet with, ideally, brought up with all these, food biases that kind of guide, that can hinder how we eat. So that's important to Bloom Nutrition as well. And then nutrition during pregnancy and postpartum matters because moms deserve support and not more pressure. So many women try to navigate pregnancy and motherhood while still managing unrealistic expectations about food, body image, and wellness. And being or having compassionate nutrition support can help moms feel more confident, less overwhelmed, more connected to caring for themselves in a sustainable way, especially at the same time reducing overwhelm and confusion. And then next slides, I just have a couple slides about payment options. Bloom Nutrition is private pay or self-pay, um, but I do offer package options for multiple sessions, and HSA or FSA funds may also be used for nutrition counseling services. And at this time, I don't currently take nutrition or take insurance, but I'm happy to provide clients with a super bill that they can submit for possible reimbursement, depending on your uh, insurance plan. So I'm happy to answer any questions about that. And then, yeah, just to wrap up, my goal is to help women care for themselves through realistic nutrition guidance and intuitive eating principles while supporting their physical and emotional well being and helping women be nourished, confident, and supported during pregnancy and postpartum is the goal. So thank you so much for listening to me today, and I'd be happy to take any questions now. I do too have to head out soon, but if there's any immediate questions, happy to take them. If not, I think there's another way to ask your questions
Yeah.
afterwards.
Thank you so much, Julia.
Yeah.
I love hearing about the connection you made on the importance of nutrition and healthy eating for both mom and baby. That is super important.
Mhm.
Thank you for sharing your insights and expertise with us. If anyone has any quick questions for Julia, you can put them in the chat. I will give you a minute because Julia also has to leave. Um,
I
Go
have a
ahead,
quick
Julia.
question for you, Julia, that came up as you were presenting. Does your nutrition change when whether you're breastfeeding or not breastfeeding your baby? Do you recommend moms eat certain things more or less of?
Mhm. Yeah, definitely breastfeeding introduces, you know, another nutrition realm because, again, just like during pregnancy, breastfeeding takes from the mom. So you do have increased, excuse me, you do have increased calorie needs, increased nutrient needs. So like we really do hone in more on, trying to eat enough. That's kind of the hardest part after pregnancy. If are trying to heal your relationship with food and your body, just continuing to fuel your body really well for pregnancy or for breastfeeding is essential. It can feel hard when your body's changing so much to feel like you're eating similarly to when you were pregnant, but you actually have more needs calorically when you're breastfeeding than when you do pregnant. So there is that. And then, but also just in general, postpartum, like regardless of how you are feeding your baby, you still have needs that are important to be addressed. Like you've just been depleted of a lot of, nutrients during your pregnancy. So it's important to focus on that. So we do that together too.
Thank you.
Mhm.
I have a question. Do you have a nutrition myth that you've heard that you could share with us? I can think of one off the top of my head. Not eating sushi while you're pregnant, for example. Is there another myth that you've heard folks come to you with that you're like, actually, this is not true?
Mm. Um, let's see. I mean, I've heard a lot of a lot of them probably for every food out there. Heard
Yeah,
the
or
concern.
maybe not a myth, maybe something that people don't know
Hmm. Hmm.
that may be beneficial for mom to be eating,
Yeah.
uh, or to
Hmm.
stay away from.
Yeah. I mean, the biggest like something I work on a lot with my clients is like iron intake. So making because just your iron stores are depleted a lot during pregnancy. So just making sure you're eating enough of that. Red meat, leafy greens, um, and then trying to when you do consume those things, trying to distance them from like consuming dairy products or things that can interfere with the absorption of iron. So that's kind of a tricky thing. And then sometimes you'll get put on iron supplements by your OB, and so just timing how when you take that, because if you take it, with a glass of milk, it won't get absorbed at all. So just that's kind of like a trick, like kind of tricky, but kind of a fun thing to learn about, like what to eat with iron to help you absorb it the best.
Yes, that's awesome. Learn something new.
Yeah.
Thank you so much, Julia. And again, if we have any other questions, we will be sure to share them with you.
Yes, thank
Thank you
you.
for being here today.
Thank you very
And
much.
then next we have Talia Keschner from Raquel Pérez PT.
Hi, everyone. Thank you for having me. Sorry if there is now a glare in my face. My name is Talia Keschner. I'm a pelvic floor occupational therapist, and I work at Raquel Perlis PT in Wellesley. Raquel Perlis, she is the founder of the company. She's been in the field since 1990 as one of the first women's health and pelvic floor therapists in Massachusetts. So it's pretty awesome to be able to work from her and to learn from her. There are three of us that work in the clinic. Pelvic floor therapy is something that I became passionate about after my own postpartum experience. I was able to see firsthand how impactful this work can be and how little information and support exists for this population. As a pelvic floor therapist, we're working with women in all stages of life. We're helping women prepare for birth, recover after delivery, addressing pelvic floor symptoms so they can feel strong and supported throughout their motherhood and beyond. So, kind of to start off with, what is the pelvic floor? Thank you. The pelvic floor, so it's a group of muscles that's at the base of the pelvis, and they play a major role in many of our everyday functions. So I kind of like to describe it as a foundation of a house. It supports everything above it, and it responds to the pressure and demands that we place in the body throughout the day. So it's pretty unique because there are several systems of the body that are overlapping in this pretty small part of the body, including the bladder, the bowels, the reproductive systems, our sexual function, and our core support system. So, because everything is so interconnected, if one area is irritated or under stress, it could affect and influence other areas too. So, someone that's coming to see us may experience pelvic tension with constipation. They might also have back pain and discomfort during intimacy. Um, the pelvic floor, it's constantly working with everyday movements when we're walking, when we're lifting, coughing, running, jumping, carrying a child. It's an area of the body that we've become very disconnected with, but we need these muscles to be in good health, be able to contract, be able to relax in order to manage pressure and support the body throughout the day. So, especially in pregnancy, these muscles are adapting to this increased load and pressure as our body changes to support a growing baby. Birth is a major athletic event, and recovery deserves a lot of support at this time. So, we're working with women who are trying to conceive, who are pregnant, who are postpartum, and even beyond into perimenopause and menopause. So, despite how common pelvic floor symptoms are, many women don't realize that this type of care exists. In fact, 1 in 3 women will experience a pelvic floor disorder in their lifetime. In many other countries, not in the US, pelvic floor therapy after birth is considered just part of the routine care. It's kind of like an immediate referral. Here in the US, awareness is growing, but many women are still hearing about it much later than they should. I can't even count how many times I've had, women say to me, they could be in their 40s, 50s, 60s, like, why am I only learning about this now? And it's true. I think a lot more of this information should be shared publicly, and it is getting out there, but our goal is to work with like one-on-one with our clients to kind of reach their goals. We can go to the next slide. So, how does pelvic floor therapy support our families? Pregnancy, there are a lot of changes that are occurring during this time. So, it's not just that our belly is growing. As a baby grows, our body has to reorganize around that growth. So, our posture shifts, our center of gravity moves forward, our breathing mechanics change. The abdominal muscles and the pelvic floor have to adapt to this increased pressure over time. And there's a lot of adaptation that's happening in a pretty short period of time. To be honest, most women are kind of expected to continue functioning normally while their bodies are changing pretty dramatically. And because of these changes, many women are experiencing symptoms like pelvic pain, rib pain, sacroiliac pain, some rib discomfort. They might experience urinary or fecal leakage, heaviness, or constipation. And I like to remind my clients that while these symptoms are very common, they're not something that you simply just have to live with. I know in my own experience, when I was going to the OB, they were like, yeah, it's pregnancy. Everything was always just, yeah, it makes sense, it's pregnancy. And they would kind of just push it off. But these are things that can actually be worked with and worked on. So during a pregnancy, we're helping to manage that discomfort, improve movement, and support the body as a lot of these changes are happening. We also focus a lot on birth preparation, and I kind of compare it to training for a marathon. You wouldn't expect your body to go through this large physical event without support and preparation. And in order to prepare the pelvic floor for birth, it needs to learn how to relax. A lot of people hear about Kegels or tightening, but the pelvic floor needs to be able to lengthen and release during labor and delivery in order to allow space for the baby to come out. So we work a lot on breathing strategies, pressure management, pushing mechanics to help the body work more efficiently during birth. Next slide. All right, so postpartum recovery is one of the biggest reasons I would say that people seek out pelvic floor therapy, but it's also one of the most overlooked stages of care. One thing I like to remind my clients is that when they're cleared for activity at 6 weeks, it's not the same thing as being fully recovered. And most women receive very little guidance about how to safely rebuild their strength and their function after birth. Whether someone had a vaginal delivery or a C-section, the body went through a major physical event. So we work on recovery such as healing of the vaginal tissue, scar mobility if there was any tearing or an episiotomy, C-section scar care, rebuilding core strength, and helping women return to movement with more confidence. The image on the slide shows something called diastasis recti. That's a separation, or you could think of it as a widening of the abdominal muscles that commonly occurs during pregnancy as the abdomen has to expand to make room for a growing baby. This is a very normal adaptation during pregnancy, and just because you have it doesn't mean that something is wrong or that you're not going to be able to heal well. So we work a lot on like breathing mechanics, improving the coordination, core support, and gradually rebuilding the strength so that you could take on your new role in motherhood, or beyond. Support, doesn't stop in the postpartum period. We're working with women through perimenopause, menopause, and beyond, helping to manage symptoms like urinary leakage, constipation, pain, prolapse, and strength. Next slide. So why does pelvic floor therapy matter to the entire family? So when we support, similar to what everyone else has been getting at, when we're supporting a mother's health, we are supporting the entire family. Pelvic floor therapy helps mothers experience less pain during pregnancy, be better prepared for labor and delivery, improve their postpartum recovery, and also for them to just have more confidence, to be able to return to exercise and their daily life responsibilities. A big part of it is just helping women feel more confident. Because, we're starting to carry a baby, lifting a baby, walking up and down stairs, exercising, and we want to be able to do these things with less discomfort. And for babies in the family, while the benefits are not necessarily directly to them, they are very meaningful. So when a mother feels physically stronger and more supported, she feels more comfortable in her body. It's easier to take care of your baby. So feeding, carrying, rocking, lifting, all these repetitive movements that kind of come along with early parenthood become just easier and less uncomfortable. During labor as well, improve mobility, positioning options, understanding how to, push your baby out. This also just allows for a more adaptable birth experience. So when moms are supported, babies are supported too. So when should you actually seek pelvic floor therapy? We can go to the next slide. So one of the biggest misconceptions about pelvic floor therapy is that you only need it if something is seriously wrong, but you actually do not need to have symptoms to benefit. There's so much information online and on social media. Sometimes it's difficult to know what's actually normal, and it can create a lot more fear and confusion. So, one of the benefits of coming to see a pelvic floor therapist is getting that individualized support, working with someone who can actually look at your specific body, your symptoms, your goals, kind of take your entire life and home situation into account rather than kind of this one size fits all approach. I think it's also really important to normalize how common these symptoms are, but just because they're common, it does not mean that we need to live with them. If symptoms do come up, like leaking, pain with intercourse, feeling heaviness or like something is falling out of you, core weakness, constipation, painful scars, back or hip pain, those are just signs that your body can benefit from support. And while these symptoms can be common, you do not have to accept that this is your new normal. And how do we actually get started with pelvic floor therapy? So sometimes accessing care can feel confusing when insurance is involved, and this kind of deters people from seeking the care that they might need. So our clinic is an out-of-network practice, meaning that we do not take insurance. We do provide a super bill that you can submit to your insurance company for potential reimbursement if your plan includes out-of-network benefits. Many people also use their HSA or FSA funds, if that's applicable. If you're considering care, two helpful questions to ask your insurance company are, do I have out-of-network benefits? And do I need a referral for a PTOT pelvic floor therapy? And next slide. So I'm kind of just going to leave you with one thing, that pelvic floor therapy is not just when something feels wrong. A lot of it is preparing for birth, recovering postpartum, and preventing issues down the road. And you don't need to figure it out alone. There are, a lot of us out there to help support you during this time. And here's again some information on the slide about the practice that I work for. And thank you so much for being here, and I'm happy to answer any questions.
Amazing. Thank you so much, Talia.
You're welcome. Thank you for having me.
I think the final slide, Karina, is just a thank you to everyone. If anyone has any questions in the chat, I have a few here already. This question is for Dr. Michaela. What are some signs parents might notice that could indicate a baby would benefit from chiropractic care?
Oh, great question. So I didn't touch much on pediatrics because I was focusing on mom for our presentation, but things that I would look for, let's say 0 to 3 months, red flags would be a preference to looking to one direction. So maybe they only look to the left side. Um, I would also be very mindful of constipation. So if we're not having a daily bowel movement, that is very important. Pooping babies are happy babies. When baby thrives, families thrive as well too. And my third big red flag, a reason why an infant 0 to 3 months specifically could use chiropractic care would be a history of birth trauma. So maybe that 48-hour, 3 day induction, baby got stuck, baby needed a vacuum assist, baby needed an emergency C-section. All of those things can cause a lot of strain or pulling on the body, which can lead to tension, and tension can lead to dysregulation and dysfunction. So those would be my big ones for my little guys.
Amazing. Thank you. We also had someone in the chat, not a question, just a shout out. We saw Dr. Michaela postpartum with our newborn for a tongue tie he had, and it was amazing for us and baby. She said, highly recommend.
I appreciate
Um,
that so much. Our little tribe is growing so much.
yeah, we love that. Thank you. We have a question for Talia. Can women use pelvic floor therapy even if they aren't pregnant?
Yes, definitely. I would say most of my clientele is between the ages of 18 to like 65 right now. So even at 18, some of my clients have pain with like inserting a tampon or they're not able to insert a tampon. Um, so we're working a lot on regulating the nervous system as well as also helping the tissues and the muscles to be able to lengthen and relax. Working a lot with clients that, want to have intercourse. They have never been successful at intercourse because of tightness. So yes, definitely do not need to be pregnant, in order to come and see us.
Amazing. Thank you. And another question for you. What can people do at home to support pelvic health?
Okay, well, that's a very loaded question. So pelvic health, again, it's incorporating a lot of different systems. So avoiding constipation, if you have regular, comfortable bowel movements, it's going to help your urinary system and your reproductive health as well. So, getting a squatty potty, so kind of releasing that muscle that wraps around the rectum in order to have a bowel movement helps with like full evacuation. So you're not feeling bloated, or you might not be feeling, some people experience bloatedness or just like heaviness in their pelvis. And sometimes the simple solution was really just like figuring out their constipation. So definitely avoiding constipation, using a squatty potty, having enough fiber in their diet. All this is pelvic health as well. So I like to recommend chia seeds for a lot of my clients, kiwis, stone fruits. So, and also drinking enough water. So they say, half your body weight in ounces should be the minimum amount of water that you should be taking in a day. So kind of just keeping those things. Um, Exercising and moving and being aware of how to find your core muscles is also really important. So being aware of how to activate your core correctly during everyday exercise, I would say that's been very beneficial for a lot of my clients as well, because a lot of times they don't realize that either they're breathing incorrectly or they're engaging the wrong muscles when they're doing their exercises. So kind of making sure that you're activating the right muscles with movement can be very beneficial for your pelvic floor.
Amazing. Thank you. I know I'm taking notes. I'm like kiwi, chia seeds. I am not a mother yet myself, but this has been super informative for me as well, selfishly. So thank you. And one last question for Dr. Michaela. What advice would you give new parents who are curious about chiropractic care but may feel hesitant or nervous?
Oh, it's a great question too. Um, can I clarify? Is the question in regards to pediatric care, like babies,
Hmm. I guess
or is
maybe
the
both because
concern pregnancy? Okay, we can do both. So I'd say the biggest chiropractic myth out there is that you have to get racked and cracked and twisted in all these weird shapes and ways, and that is absolutely not the case at all. There are a lot of different ways we can adjust the body. An adjustment is just creating motion throughout the joint. It does not need loud popping noises in order to do so. In our slide, you can actually see a picture of a expecting mom laying on her belly. So the table drops down, and that actually allows space for belly, but I can use tools such as my activator here. This uses speed to deliver force into a joint. It makes a loud click noise, but it is soft and gentle. So again, no popping or cracking noises of the joints, which that noise is really just air bubbles leaving the joint. But I'd say that's a very common myth is people are nervous or scared to experience that noise or what they see on these crazy TikTok videos, which most of the time we are not doing those things, especially with our expecting moms. Everything is low force and gentle. Similar with our babies as well too. With our little ones, we're actually using about a pound of pressure. So what you would use to check the ripeness of an avocado or dimple a tomato would be that pressure. And with that, you'll see a sustained amount of pressure maybe like impulsing or tapping, but it's a lot of stretching and mobilizations. And so that also is a very gentle, soft, and safe experience for the littles. Most of the time, they sleep in my pillow. They're all a little cozy. If you go to our Instagram page, you can see lots of cute videos of babies sleeping on their chiropractic pillows during their adjustments. But pregnancy and pediatrics are a lot more low force techniques. And if you're nervous about it, coming here and having that conversation with us opens the dialogue for us to be able to better figure out which treatment style is best for you. If you don't want that, we don't have to do that.
Amazing. Thank you. Yes. I think we were all thinking the same thing. We see those TikToks and we see people bending like a pretzel and cracking and thank you for addressing those misconceptions.
Yeah,
So
some people love that, but it's not for everybody. And that's okay too. We don't have to do that.
yeah, for sure. Karina, do you have a question?
I do. I know you saw my mic go off. It's actually a question for Tyler. Um, can your pelvic floor become damaged during birth and, well, giving birth? And can your pelvic floor repair itself over time? Or do you have to actually have intervention?
Okay. Well, I guess the simple question is it depends. Obviously, every single birth experience is different, and the person who went into birth has different range of motion, flexibility, strength, from one another. So, I don't like to call it damaged. Some common things that women might experience is like perineal tearing, right? So, like either they're tearing naturally or the doctor is like cutting, called an episiotomy. So when that happens, there's usually a scar that forms afterwards. So we like to recommend that our clients massage out that scar to prevent adhesions from forming, which can cause, additional tightness and potentially lead to other, issues down the line. When it depends if you have a vacuum assisted delivery, if they're using forceps. Obviously, all that is putting additional pressure and tension at the pelvic floor. If you're having an epidural, you might not feel your contractions and know how to like, push effectively. And you might be purple pushing, which is just like sending a lot of downward pressure while holding your breath. And it's not, the best way to get the baby out. So sometimes it's needed in order to move things along if the baby doesn't seem to be like descending into the pelvis. So yes, I mean, some things will repair itself with enough time, but most women, I would say, do need some support after birth. So whether it just be education, checking in to make sure that everything looks good and that they should feel comfortable going back to movement and exercise. And some will need a little bit more support, like if they experience prolapse, which is kind of like a laxity in the vaginal walls where organs kind of start falling, descending a little bit into them. And a lot of our patients will feel heaviness and pressure. So we do want to like retrain the system um, how to gain strength and mobility during everyday movements. So it is something that, some parts could go back, like diastasis recti. Again, that's a very common thing to occur during pregnancy where the abdominal muscles are separating. And some women just need some more help to bring them back together and to be connected to their core again.
Thank you. Thank you so much for that.
Thank you. I don't see any other questions in the chat. I wanted to say thank you again to all of our wonderful speakers for sharing your knowledge and your time with us today. Thank you to everyone who attended, participated, asked questions. We truly appreciate you being here, and we hope you're leaving with some valuable information and resources to support yourself, your families, your communities. We will be posting and sharing this recording as well as sending out a quick feedback survey. We would love to hear your feedback and hope to be able to provide something like this again. So thank you so much, Dr. Michaela, Talia, and everyone else for being here. If we have one more second, actually, I just got a question in the chat. For the companies who presented and who do not currently accept insurance because insurance doesn't cover their services, are you actively pursuing legislation reform to require insurance to recognize and cover these services? It seems like there's a massive gap in the healthcare for women in general, let alone the care needed around pregnancy. Sorry to just throw that on you, but this is a very important question. So if you have a second.
That is a really important question. I actually, it's it's a very complex question, right? So I will say that during chiropractic school, the students are sent to, we have an option to go to Washington, D.C. and lobby on Capitol Hill about getting various different chiropractic bills passed. While I specifically did not focus on women's health care during that time period, I was a part of very many bills that got passed for VA benefits. So now you'll see chiropractic care in more VA hospitals, which is really awesome. And so through the Chiropractic Association, there are various different bills that are working on getting passed, but it is slow moving progress. It's in the works, and then the students are trying very, very hard to get some of this passed.
Go ahead, Talia.
I've not been personally involved, just because I've been working with Raquel for like the past year or so, so a little bit newer to her practice. I would say, there are practices that do take insurance. The issue with working with insurance is that they a lot of times will kind of dictate what you can or cannot do, and it's much harder to kind of use an individualized approach when we're working with our clients and doing what like fully benefits our client as opposed to doing what will make, the most money. So it is tricky. I think it's something that should be available to everyone, and I do have a very hard time with the idea that it's not. And I don't think that's right. And I do hope one day to make more of an influence at that level. But for the time being, I know a lot of clinics will use like a sliding scale if that's necessary. And sometimes you can fight with your insurance company to get reimbursement. But yeah, I wish that wasn't the case.
Yeah, I think
But
safe to say we all feel the same way. Go ahead, Dr. Michaela, sorry.
oh, I was just gonna agree with what Talia had to say as well too. It was not an easy decision for our office to become cash based. We used to take a wide variety of insurances and working with them as a small practice when you're spending hours on the phone begging, pleading, and borrowing for an insurance company to cover um, a pregnant woman's care, but because you're working on body parts that are outside of the spine, it's not covered. And it's very infuriating and frustrating when we know the amazing benefits that are included in that. And there are companies or practices out there who do support insurance-based practices as well too. But you will find that the back pay of that will be quite high as well too, often with the services that are not covered, which is again like a barrier in an act like to care.
Yes, it is unfortunate. And I think we are all, especially from what we've seen here today, passionate about the work we do. And that is our hope with the shared services and this maternal health initiative is that we can provide as many free services as we can, whether that's, direct care or that's providing education and knowledge and awareness around things that may be able to be covered by insurance. We hope that things will change for the better. And in the meantime, we will keep being passionate about the work we do and advocating, which is important. Thank you, Dr. Michaela and Talia, for taking that final question. Thank you again, everyone, for coming. We hope to see you again soon.
Thank you, everyone.